A group of Michigan physicians voiced support for a package of bills in Lansing that encourage vaccine access and information amid rollbacks of some recommendations on the federal level. The Committee to Protect Healthcare says more than 260 doctors have signed a letter of support. News 8's Kyle Mitchell spoke to local doctors about their concerns.
Navigating changes in vaccine recommendations in Washington can be confusing for patients.
You're trying to take care of yourself, you're trying to take care of your kids, your parents, and you're kind of looking around saying, well, who do I listen to? Who do I trust? Like, what does that look like?
Dr. Andrew Jamieson, the Section Chief of Infectious Disease and Medical Director of Specialty Medicine for Trinity Health West Michigan, is concerned about the message rolling back vaccination recommendations will have on people's health.
My big picture concern is that some of these changes are happening without a basis behind them. So like that's my first concern when I'm looking at this is like, well, what is this based on and where are we at?
Many professional groups have not supported the changes in policy made by the Advisory Committee on Immunization Practices, who were appointed by Health and Human Service Secretary Robert F. Kennedy Jr., who has been a skeptic of vaccines.
We've kind of moved into a world where we had a lot of transparency on what the reasoning behind the decisions were into a world where like it's more vague and you don't really know what it's based on, and there's kind of opinions being shared rather than consensus.
One of the biggest recent changes was lowering the recommendation level for vaccinating newborns for hepatitis B from a universal recommendation to a shared decision-making recommendation.
So a universal recommendation means that we have enough evidence that shows that when we give it to every single newborn, we can prevent almost every case of hepatitis B that's contracted in the newborn period. And the vaccine itself is overwhelmingly safe in the newborn period.
Dr. Kira Siplinga, the division chief for general pediatrics at Helen DeVos Children's Hospital, says a universal recommendation remains in place from the American Academy of Pediatrics.
If a newborn were to contract hepatitis B and it infects the infant, it becomes chronic in about 90% of cases. And when you have chronic hepatitis B, you have lifelong liver disease.
Dr. Jamieson says the best approach to addressing vaccine skepticism is by listening and having good conversations with your doctor.
They can be hard, but they don't have to be. But now what we're getting, unfortunately, is those individual conversations trying to be applied to a big policy, and then more people are going to get hurt because of that. And that's just a reality.
In Grand Rapids, Kyle Mitchell, News 8.